Hey everybody, Jared Wallen here, selfdirectedmedical.com. Do you ever wonder if your employer is doing the right thing regarding your health benefits? Well, ultimately the reality is we're going to be releasing a few posts this week, and I wanted to give you some framework to think about these posts, and that's why I'm doing this video for you today. Ultimately the employer has a fiduciary duty to deliver the highest quality, lowest cost health plan to their employees. I think we've seen, a variety of different things you'll see. As one is the premiums are going up and up every year. More of that is being shifted to the employee every year. And to a large degree, remember, there's been a wage freeze as far as increase in wages compared to inflation over the last few decades. And so when you look at essentially a stagnant inflation to wage graph, and you look at 111% increase in premiums for health insurance, you really start to see the difference in, how stark contrast there is between premium growth and wages. And so from that standpoint, the reality is that your employer is a fiduciary, which means that they have the legal and ethical responsibility to provide you the highest quality, lowest cost health plan that they possibly can. And again, when we look at the amount of profits that these big health insurance companies are making, the fact that 60% of folks aren't even using their deductibles, aren't even meeting their deductibles, and so that's more money that they're paying out of pocket, and the fact that premiums are rising every year, the fact that more and more care is being denied, and or patients are having to shoulder more of the money that's spent on healthcare on an annual basis. And so from that standpoint, you have to ask yourself, is your employer really doing the right thing for you? So that's part of the reason we created this medical education program, to help increase the knowledge that's out there for the everyday average American and everybody else as well, to start to question these things and start to push for change, because the reality is the patients are the ones that can make major change. There's 336 million Americans, and all of them are patients. And so from that standpoint, I always say this: if the patients and the healers stand together, the game is over for the insurance companies. And so, ultimately, really questioning if your employer is doing the best thing for your health plan and for your family in regards to your health plan, as well as your other colleagues. And ultimately there's a link down below to sign up for our webinar that's going to be on September 1st. We'd love to have you join. It's a free webinar, and we're going to be talking about a lot of this stuff as far as options to essentially kind of creatively finance your health care or medical care, and also essentially beating the insurance game and getting out of the circus, so to speak. So thanks so much for watching. If you liked what we were sharing for you today, like and subscribe to our YouTube channel and all our social media outlets to get more content. Thanks so much, everybody. Have a great day.